Hello, everyone. My name is Annette Graves, and I'm a regional family engagement specialist with the ARC Tennessee. And this evening, Kendra Jones and I are co-hosting our Tuesday evening family engagement session. Now, these sessions are designed to give you resources and information for your students that receive special education services. These sessions convene every fourth Tuesday night in the month. Now, tonight we're excited. We have a presenter tonight from the state of Tennessee. She works with, her name is Terry Williams, and she works with Tennessee Health Connect. TCG is a local nonprofit, and they have a mission to help decrease the number of uninsured people in Tennessee. So at this time, we're gonna make her co-host, and she's going to come and talk to us about healthcare in Tennessee. Terry?
Good evening, everyone. Thanks for allowing me to present to everyone in the session today. And what I'm going to be doing is sharing what we do. I'm going to help. I'll go back to the names here. I'm going to help Annette out with the name a little bit. We're not Tennessee. It's just TCG Health Connect. We are located in the southern area of Nashville, Metro Nashville, Davidson County. We are a mobile organization. We go out to assist people in the community. So what I want to do was just do a quick outline of our organization and explain who I am as the CEO, as president CEO of TCG, and a little bit about my background and some of the people who have been founders and how we came to be. TCG Health Connect is a nonprofit organization located in the state of Tennessee. I'm the founding member, one of the founding members. There's 4 of us all together that founded the organization in the healthcare education realm of the 501c3 categories. I wanted to share what makes us present in the community, which is kind of sort of what you would say, what our background is. We work at the federal and state levels. I am a certified application counselor, certified through the federal government and licensed through the state of Tennessee to work in the community on a personal level with consumers. We term clients who are enrolling in healthcare or health insurance. My job is to assist people in the community with understanding federal and state healthcare portals that help people enroll in healthcare insurance. At the federal level, it's the federal marketplace, which has open enrollment in November through, last year we had through January, but normally it's into December. And also at the state level, which is TennCare, which is the next level just below marketplace, but it's at the state level, which is termed Medicaid. We also have a specialty that we do assist people who are getting ready to turn 65, and we help them with enrollment in Medicare. We also have a couple other programs and initiatives that we do in mental health and in assisting women with breast cancer, and assisting people who've been incarcerated, along with other categories with people who qualify for healthcare insurance under the state or federal level. So technically, how we do this is that we help people put their what they would term their background information at certain federal poverty levels, percentages, where they qualify for discounts at the federal level, which would be discounts on your monthly premium. And you get, there's tax discounts, there's various different discounts that help you save money on that. And our biggest thing to do with people one-on-one is to help them understand how they can get discounts and credits in various areas of healthcare insurance, whether it be through the federal marketplace or it be through TennCare. In most cases, if you're at the state level in TennCare, a certain percentage of people, at least 50% of people who qualify under the federal poverty level, for them, their insurance, healthcare insurance is free. We also have been trained in various levels of understanding people dealing with various levels of disability who qualify for both levels, federal and state. Also, people who were on maybe SSI or other areas that through Social Security that qualify as disabled under those categories. One of our passions, though, is to reach out to the community with people who have complex situations with applying at marketplace level or at the TennCare level. A lot of times we go to bat for those people who have said, well, we don't understand why we don't qualify. And or they say they can't find the category that they qualify under, especially under the TennCare classifications, and we help them try to find classifications under those areas. One of the areas that one of the ways that we technically help people understand is by talking with them and getting a full understanding of their background and why they feel they qualify. We also have partnerships with organizations that help people through, let's say other community organizations who help, like Tennessee Justice Center, the aging disability organizations. We have partnerships with Pencil, so we work in the southern quadrant of Nashville, where we have partnerships where we help out at local high schools or either elementary schools in this area. And we continue to be able to help people out that maybe have extreme complicated situations. Like, for example, maybe the family unit, it makes a certain amount of money that doesn't appear that they qualify. But once we take a good look at what their take home is or what their classifications are, then we can talk them through how they would qualify. In one case, we were able to help a family who was struggling with getting one of their children an EpiPen, and they told us that they have tried several times and did not qualify. But after we got in and spoke to them and really got familiar with their situation, we were able to help them get qualified to get their child a EpiPen. Another area that we work in is we also joined with the Hispanic community. We've done outreach with the Hispanic community for people who really do not understand how they would qualify as people who weren't born in the United States or who come here and they currently live here. We've been able to help people in those classifications qualify as well. The organization is a mobile organization. We go to public venues and help people enroll in healthcare. So what we do is we meet, like, let's say one-on-one at, let's say, Southeast Library or Emerson Pike Library. We meet you there. We give you a list of documents and things that you would bring to the meeting, so that we can all discuss how you qualify. I saw a question pop up about translators. Yes, we have a translator on staff who goes with us for various events that we do for outreach, and she is also on site if we need one for to help with enrollment. We've been very successful in the area, and I'm excited to say that we really enjoy sometimes even learning to say new Spanish words. And we always say thank you. We say the nada to our Hispanic community, and they kind of laugh at us because they want to know, okay, well, y'all know a little bit, without the translator. But the translator is always happy to join us as a volunteer with the organization. As I mentioned, we are also a mobile organization. We also go to various promotions around the city. We will be at Hadley Park this Saturday doing outreach in that area. So that is pretty much us. We really, really, really enjoy getting out to help people. During the COVID, we had to be a little more creative with our outreach because we did a lot of stuff virtually, but to get out and actually let people know that we were doing it virtually, we had to put posters up in different areas and ask some of our partners if they would allow us to advertise on their Facebook pages so that they could reach out to us and know that we were doing open enrollment. Some of our board members have come together and talked about what type of other healthcare promotions we would do, and we allow each board member to share their healthcare passion. Over the COVID time period, we did youth mental health because we felt that our children, were dealing with so much at that time period with, being at home full time. So what we did was youth mental health kits. What we did was partner with organizations that do after school programs. So they were able to give us a head counts on how many we could deliver to them or we could deliver to other organizations. So the kids could get the youth mental health kits. What they were their self-care kits for kids. So what we gave was hot chocolate, a journal, and some fuzzy slippers in the kits. And they went over really, really well with the kids. They really enjoyed it because it allows them to have, a time away from, the computers or playing with their phones and those things that they do. Their parents try to get them to, take a moment to, do something for yourself. We did this past Christmas, we did Christmas stockings. In the Christmas stockings, we pretty much did the same thing. So this is an ongoing thing for us. And we have partnerships with about 2 organizations that have after school programs that we are able to do outreach to the children. So that's pretty much it we do. Does anyone have any questions?
I don't see any more in chat right now.
Your program is so unique in the fact that you go out to reach the people. I think it's a very unique program where you go to the people and get them signed up. Do you go to a school open houses and those kinds of programs?
We joined Antioch High School for 2 of their events this last year. They did a trick or trunk, and they did a family night, which is where I met Kendra. Also, something's not charging here. We did, as we said, we we joined the Hispanic community. We went to Plaza Mariachi for their community baby shower. You say, well, women are already pregnant, they already have insurance. You'd be surprised at how many women don't know they qualify for TennCare. So we were at their baby shower doing outreach there. So we do a variety of things. The one we're doing Saturday is for people, who have been incarcerated, letting them know that they, within a certain time limit, they would qualify for TennCare or Marketplace.
And you do travel throughout the state?
Yes.
So you're going to come to West Tennessee for my events, correct?
That is what I was invited to. I'm excited about that. So what we do is we come set up a table. We have brochures we give out. We do a little bit of on-site consultation with people. They privately share with us some things that they are going through. Our big thing is our security, with letting people know that once we handle your information, we have a certain amount of secure process policies and those things in place that, that make sure, with me being licensed through the state of Tennessee, that means that background checks and things are been done on us, to ensure that once we touch people's personal information, we make sure that it's secure.
Okay.
More questions? Yes, security, Kathleen, is very important. We also have been developing some handouts to be able to share with people to let them know, how we secure their information. If we keep any information, majority of the time we return their personal documents back to them. But if they take us longer than the hour it usually takes for registration, then we get them to sign, we both sign confidentiality forms, stating that, your information is safe with us. We're also concerned about how people use their electronic health record systems. We have been with some groups who have been talking about the use of telemed. It was used quite a bit during the COVID time window. We didn't have our program set up at the time, but we've been working on it. We want people in the community to know that they have access to electronic health records at their at their disposal. When they're even using their phones, they can go in and send, notes to their doctor. In most cases, most insurance policies cover telemed for free, especially if you have children. So we want people to know that, you don't have to hop in the car and take your child to the doctor every time. You can, get on, telemed and talk to a doctor or talk to a nurse or, someone who, works in family practice. So that's another promotion that we do. And we should have those up on our website in the fall. We've been working on some videos to get to put on the website so that people can, watch videos and learn things like that, because those services are available to people. People don't realize, they're waiting on 2 or 3 days for a doctor appointment, and their child is ill or has earache or things like that. You can just get on a telemed and explain what your symptoms are. In some cases, the doctor just takes a look at the child and sees if he's in, some kind of stress, and they will help them, on site, and that's what we do. So I just want to make sure, we share it with y'all. And Kendra, I really appreciate the opportunity to share with you guys and become a partner at some point to the ARC.
We appreciate you. I did have a question I was thinking as you were speaking. How long is the approval process usually for parents to know whether or not they have been approved for the health insurance?
We usually get approval within a 2-week time period. Sometimes we get it like right away. When we do Marketplace, if it's open enrollment time period or one of their, like right now they have a promotion going on for people at below a federal poverty level of 150%. And let's say we enroll them today, the insurance will start Sunday, which is May 1. So all they need to do is, if they're required to make a payment, which a lot of times is between $0 to $100 a month, which is really cheap for healthcare insurance. They make that payment, let's say by the end of the day on the 30th, and they have insurance on the 1st of May.
Okay.
TennCare sometimes takes a little longer. Their processing is a little different, but Marketplace, most times we can get there right away.
Okay, that's good information. Thank you.
Do we have any more questions in the chat, Kendra?
No, I don't see any more in the chat at the moment. No.
All right, Terry, did you put your email address so we can contact you in the chat? And also you mentioned a website.
Yes, I'm gonna stick it in right now. As I'm operating on my phone and I'm trying to find the little buttons and they're really, really tiny. You're doing it on your phone. I'm gonna put it in right here now. The TCG Health Connect. Let's see. At gmail.com, and our website is TCG Health Connect. Our social media is also of the same name. I'm going to put our phone number in here. Let's see, I'm going to have them call this number for now. I have a number on this brochure that I sent. Here we go. I'm going to put this in here. That's 4-2-3. Missed the line there, but I'm gonna leave it. I think everybody can interpret that phone number. It looks a little quirky because the dash is missing. So we can be reached at the Here we go. You guys see me? Still trying to operate the phone.
Yeah.
I'm so used to clicking on the button when I'm doing the when I have my laptop, and it's not letting me bring the screen back up for some reason. Okay, here we go. Close. Okay. So one of the things I do also want to mention is that, we understand that people, work during the day and they try to find times to meet with us. We do evenings and Saturdays on request.
Oh, yeah.
We rarely do Sundays, but we have done some Sunday evenings to meet people at those locations, which is, what pretty much what we do, since this is our full-time thing. We don't mind meeting people in the evening or on the weekend.
Okay, that's.
And then
good.
I guess I better mention that we do virtual. We have virtual procedures that we do. We let people know that we send, that we email them the confidentiality documents. The federal government has released us to do that. Certain steps we can do that we are certified to do through the federal government. They were very creative during COVID, which allowed us to be more open with being able to communicate with people. We also, let them know that we send them the security information, let them know that, anything that is transformed between us and them is secure information. We also talk about encryption, things between emails and things like that, which, are very helpful when you're trying to do virtual enrollment. The rest of the time we use some scan processes and things like that to make sure everything is secure.
Okay, and we do have one question in chat. The questions are: all Health Connect representatives sharing this information?
Say that one more time. Let me pull it up.
All Health Connect representatives sharing this information. Susan may have asked. Susan, can you provide a little clarity on that question?
Yes, it is. The organization technically has me, our on staff. It's me, the interpreter, and we have one more person who's coming on board who's doing the training as well. But right now, I'll say 90% of the time they would speak directly to me. At this point, we're still waiting on
Ms. Williams. The reason I was asking is we have had Health Connect representatives come to transition fairs. And I'm wondering if there are two Health Connects. Because I feel like the people that are coming, the ones that we have, are more mental health focused.
What was the purpose of the event they attended?
We were doing transition fairs for students with disabilities transitioning out of high school, going into the community, and there were different service providers there for all different avenues, for all different areas.
That was not us.
So are you guys Health Connect or are you Health Connect TGC?
The organization's name is TCG Health Connect.
TCG. Okay, that answers my questions. Thank you.
Yeah, there may be a Health Connect. I'm not familiar with that.
Yeah, there is, but it's not the TCG.
Oh, okay.
Thank you for clarifying.
You're welcome. You're welcome.
Your information is wonderful, by the way. I'm for sure going to be sending people your way.
Thank you.
Oh,
Just let us know anytime we can be in assistance. And as I mentioned to Kendra, when we begin building partnerships, we also like to come and do volunteer work at the organizations that we build partnerships with.
Thank you, Terry. Thank you, Susan, for that question. Let's see. Kathleen said that thank you for sharing. Kathleen said, thank you for sharing these links. This is very helpful, and I'll pass on to a few of the organizations I work with as well in East Tennessee. And then there was a question, are there East Tennessee reps to contact? And is there a Chattanooga representative to contact?
No, we are a fairly new organization. We've been in business 4 years in the fall. And we've only been working in the Middle Tennessee area. So we're fairly new. We're growing fast because we get, more and more partners that we love working with. So that, it would just be us. With that federal certification, we have options to work anywhere we can work. So we do that all the time.
So you would be the contact person for those regions?
Mm-hmm.
Okay. All right. And for those who may not be able to see chat, Terry did share her information in the chat, and that number was 615-482-1361. All right. Do we have any other questions? All right, Miss Annette, do you have any comments?
This has been a great session. I think I've learned a lot this afternoon because I know you all existed. So I learned a lot today. It's been a great session, and we'll definitely stay in contact. I want to thank you for sharing with us this month. And I want to tell everybody that's on the Zoom call this afternoon, the Zoom meeting, that stay tuned for next month. We'll be here on the 4th Tuesday in May with more information and more resources to help families across Tennessee. I want to remind you to follow us on all forms of social media, whether it's Facebook, Instagram, or Twitter. And if we don't have any other questions, on behalf of the ARC Tennessee and the Family Engagement Project, I want everybody to have a great evening. And thank you. And thanks again, Terry.
Thank you, Terry. And just everyone, remember, you can catch this recording on our Facebook, on our website at familyengagementtn.com. Thank you, everyone.
Thank you.
Thank you. We appreciate the opportunity.